What I wanted to mention actually is that it goes far beyond just getting a number. So far we only discussed, is it abnormal, is it normal, should we treat, not treat, get a number. I really believe that we should be using physiology to plan the procedure, to understand what we're treating, what we're not treating, to check the results afterwards. So to really incorporate it more into procedural planning and checking the results. And I think this software in particular, the new version, and I'm going to show some of the slides in my talk, allows us to basically do that. And it's far beyond just getting a number. It's really coming down to very, very precise procedural planning and then confirming that you have good outcomes.
This is an earlier case. A 76-year-old came in with a non-ST elevation MI with chest pain. So we do the diagnostic cath, and you can see that there's a high-grade lesion in the circumflex. But what's important to recognize is also there's moderate disease in the LAD, and the right has this tortuous loop with disease. Is this a patient that we should send for a bypass evaluation? Is this a person we stent? What are we trying to do? And historically, this would be a challenging kind of ad hoc kind of decision-making. So with FFRangio, we're able to quickly run the LAD, and we see that it's 0.76 and really a focal lesion. We run the right, and we see that it's not physiologically significant, but there is disease there. And then the next question we're able to do, because now we've already paid for the card, right, is in 2025, can we use AI to help with procedural planning? This is a bifurcation lesion. Do we do provisional stenting, 2-stent? What's the vessel size, lesion prep? What are the things that we can incorporate? So quickly, we're able to process the circumflex. We know that it's going to be significant, but we're able to now see what the pressure pullback curve looks like. We're able to see with lesion impact whether or not we're going to make a good post-PCI assessment. We're able to use the sizing tool to size the stent and get an approximation of the length that we're going to need to do. And then complete our intervention with IVUS guidance and get a good result. We can confirm the post-PCI result, and so we see the physiology is good. But as you'll all note, the OM looks pinched, right? And this is a clinical scenario that we often confront. So here, by just tracing the OM, we can get another data point that confirms that, hey, we don't need to do anything. We can just watch this in the patient who's asymptomatic.